Good afternoon. How are you?
Yeah.
Good. Good.
All right. Guys, we're going to go ahead and get started. So I want to welcome Sam Rubens, who is our air quality manager. He is going to be speaking on the MAC program, Managing Asthma Triggers at Home. Sam?
Hi, everybody.
Hi.
So, thanks for having me out here. It's been a while since I've been in front of board. Recognize most of you anymore, even though I've been here forever. So, before I pop them up, I want to kind of wander over this way so I can see the slides because I don't remember what I wrote. There we go. That's me. So, we talked about math a few years ago. We've been running the program. It's Managing Asthma Triggers at Home. And as part of air quality, there was a big push back in 2018, 2017, I don't remember anymore, it was before COVID, that we were looking at asthma, the chronic illness. The hospital had Children's Hospital had identified it as a big problem for them, something they wanted to work towards, and we wanted to as well. And it's really tied to what I was doing here at the health department, which was air quality and housing. So we grouped together with Children's Hospital and other groups over the years to address childhood asthma. So a little bit of background that there's unequal prevalence of asthma. Black children and adults have asthma way higher than white children and adults do. Statewide, and especially here in Summit County, you can see the graph. It's, 5-6 times higher for African Americans versus whites. And even way worse, it's 41 white children for every 292 African American children. That's a huge disparity. So we wanted to kind of work on addressing some of that. Obviously, each of us have our own kind of swim lane to be in. So the hospitals and doctors do the doctor stuff. They do the medical provision, they do the diagnosis, they treat. We don't do that. I'm not a doctor, I'm a chemist. So we here at Public Health, we can go into the home environment, look and see what's going on in their home environment. Because one of our big concerns was if one of the parents took a child into the doctor and the doctor says, hey, do you smoke around the kid? And that parent doesn't smoke at all, they would say, honestly, no. When we go to the home, there's the Folgers can on the porch full of ashes. That kid's getting smoked around. They're being exposed to environmental smoke. And the doctor would have no way of knowing that. We do because we're at the home. We also can go in and we've got a lot of our people are lead licensed, so they can look at other stuff within the home to see if the kid's being exposed to other things. And we just had one, Ryan was telling me today, they went out to a house, excuse me, they went out to a house and said, hey, let's check your furnace filter. And the homeowner was like, eh? Went down, pulled the door open, and there was a spun fiberglass furnace filter that was too small for the opening, jammed in there. So 2/3 of the space wasn't filtered, and frankly, the other 2/3 wasn't being filtered either because it's spun fiberglass. It's 90% air. It's good for trapping a feather or something, but not dust. So we're educating, we're treating, helping the families. But a doctor can't do that. Public housing and property owners, we partnered with AMHA for a while to help with their clients, help educate their staff. Prior to COVID, we were training their inspectors. When they would go out to the homes, we would talk to them. COVID kind of killed that really. And everybody at AMHA left. It was like an exodus for a while. We had worked with schools, the Akron Public Schools. They got a grant back in 2018 or 19 to do asthma stuff to minimize exposures, medical provision, and adherence to their medicines at the school environment, but that was funded, and then it wasn't funded, so that went away too. And more recently, we've started working with the managed care organizations, because a lot of our kids are on Medicaid. And so the bills are being paid by Medicaid managed care organizations. We were paying for this stuff at the time, like, well, they're saving the money, we're helping the kids, and that's the big factor, but they should kind of be giving us some boost here as well. So we're working with a couple managed care organizations. We created all these partnerships. Again, we work with Children's Hospital since 2017. We've been on their steering committee. We've been on their team leads. We've been really involved with the hospital. It's been great. Unfortunately, again, everybody's retiring, so there's a whole new crowd of people on that committee, but the passion is still there. Buckeye Health Plan has been actually, we're working with them. They're funding the equipment. They're giving us a subsidy for our time. United Healthcare is donating $25,000 to the program just for equipment, and it's not for their clients because it got dicey in the contract stuff on their end. But you know, we're really happy. Buckeye is also looking to expand our program to Toledo, Columbus, and Cincinnati areas because that's where their clients are. If I can get one more managed care partner on this group, CareSource, 75% of our clients will be addressed. So those are our big three, and I'm really trying. I've got feelers out to CareSource. I'm trying to get them on board. Our math research project, we did this in 2019, 20, and 21, and this is the requirements for inclusion in the program. They have to live in our 3 counties. Akron Air Quality covers Summit, Medina, and Portage counties. We collect the money from there, so we got to provide the service to all 3 counties. The kids have to be intubated once in the past 12 months, admitted to the hospital twice or more in the past year, or been in the emergency room for asthma 3 times or more in the past year to be included. That's kind of the definition of high risk. We kind of blew through that list, and all the ones that wanted to participate did. So we opened up to the next level, which is severe persistence, just a medical classification. These are the high-risk kids, but that's who we focused on for the research project. Children's throws them to us. We enroll the family by going to the house, talking to them on the phone. We do a home visit, look through the entire house at all the stuff, try to find asthma triggers and any other stuff that we can find. And we give them a suite of equipment. So we're giving them bed bags, you know, the allergen bed bags and pillow bags, a HEPA unit to vacuum the air for the kids in their room, furnace filters, a dehumidifier, because in the basement, if you put a dehu, it'll suck out the water, less mold likeliness. We educate a lot about mold, all the allergens, all these different triggers, pest control. We did do provide pest control in the math program, the research part. I get confused and stumble over my words because everything is the math program. Whether it's here, whether it's the research project, the current project, the one in Youngstown, the stuff that they're working on in Toledo and Cincinnati, it's all math. So I get trying to remember which one I'm talking about. But we did pest control with the original research people. What's this thing doing? There's been no operation. It's going to go sleep. I've already put the TV to sleep. The idea is that when we do this all the stuff, the pest control, people didn't really want it. It wasn't really necessary. A lot of the homes we went into didn't need it, and we were glad for that. But we did work with the company that does pest control and say, listen, you got to do IPM. The least dangerous. This kid's already respiratory compromised. You can't just go bug bomb their entire house. You're going to put them at risk. We did home cleaning as well, where we're going and vacuum and show them how to clean properly, all that kind of stuff, and communicate with them over the year. We looked at their inpatient and hospital usage, or inpatient and emergency department usage the year before we met them, the year we worked with them, and the year after. to compare. And we also looked at their, we looked at those data points, and everything went down. Their hospital usage went down precipitously, and that was the key. But we enrolled 88 kids. Half lived in a private rental, so the parents were privately paying for it. 29% lived in a house that they owned, and 21% were in subsidized housing. That's why the AMHA, when everybody retired, it wasn't like the death knell, because we weren't serving their clients that much anyways. We did hit 2/3 of our clients were African American, so that's who we wanted to see anyways, because of those disparities. The ACT is the asthma control test. Excuse me. And the asthma control test is we go out and we ask the kids or their parents, how many times do you wake up at night with breathing problems? How often does it mess up your day? Are you going to school? All these different types of questions. Only 6 questions, and 3 units is a significant increase. And you can see it goes up, but it went up by over almost 4 units. So the program was helping in that as well, that the kids felt their asthma was being better controlled. Here's the costs, that we guesstimated that a hospitalization would be about $9,000 and an ED visit about $500. So it went from $500,000 down to under $200,000. That's a huge decline in costs, not for us, but for the insurers. So that's why we wanted to tag into those managed care programs. But the idea that they're not going to the hospital as much, they're not going to the emergency room as much, that's the big push, because it's the family time and the health of the child. Since we started the program, we currently have 32 active clients. We keep poking the hospital and the managed care programs to refer more kids to us, because we want to help them. We want to keep this program going. 163 have completed a full program, a full 1-year program. And 2023, Mahoning County Health Department got a grant with ARP money to do this program. So they were funded through grant dollars, and we've sent 100 kids their way. We actually collect the referral and kick the info over. Most of our kids are in Summit County, which for the staff, they don't like driving out to Portage and Medina as much. It's a haul. But this is where the need is, and this is where our kids are. We presented this information all over the place, whether it's locally, state, and national. For some reason, they threw me on the ODH and Akron Children's Hospital committees. So Ohio Department of Health has a steering committee for asthma. We got a 2021 Model Practice Award from NACCHO, which we were really happy with. And this is a list of the people that work on the program through the years: Susan, Dawn, Karen Ryan, Rachel, Matt. It's not a huge staff, and it's only been 1 or 2 at a time. Right now, we've got 3, and we're not getting very many referrals, but we're pushing. We're trying to get them in here. Working with Buckeye so that they can pay for the stuff, and then the program will kind of be sustainable. Because that's the other big thing for me, is I'm out the door at the end of the year, and I want the program to be sustainable. I want it to be able to pay for itself. So hopefully United Healthcare's $25,000 will be able to be part of that. They'll come on as partners, and then be just like Buckeye. Air source, so that's the future plans. And there you go. Questions? Yes.
For inside air quality, you were making available the HEPA filters. Is there a program, part of the program, to go replace those filters after a period of time? How long should they typically either last or be checked?
So depending on the model, it'll be 3 to 6 months. If it's a really dusty house, you got a lot of old carpet, pets, lots of people, that filter may last less. It may last a little longer. Like we've got one in our house that we change it annually because there's only 2 of us. And it's, but yeah, we do provide replacement equipment for the HEPA I didn't mention the vacuum cleaner that we provide. that it's a high efficiency vacuum because the old school ones, you'd suck up the air and the dust would come out through the back. And, well, kind of what's the point? So we provide the filters, whatever the equipment is. And we do provide furnace filters for the year that we interact. So they get, every 3 months, they get the furnace filters.
I didn't hear anything about dust cleaning.
Duct cleaning is one of those things that it doesn't hurt. In the beginning, or in the end, it doesn't hurt. But with the ducts, they're shiny and smooth, and over time, they get rough and abraded. And as they get rough, dust collects in those rough spots. And it kind of makes them furry inside, and that's a really good friction point. So as dust is coming through, it gets trapped up on that dust, and it just stays there. So when you're if you were to measure particles on the outside, at the vent, there wouldn't be very many because they're all getting bound up.
But doesn't that stenosis eventually?
Not that much. I mean, it's not like my arteries. But it does, it shrinks them a little bit, but it's still, there's plenty of airflow. When you go through, they take a whip and clean it, but you've got to start that process all again. So all the dust that's coming through your ducts, once they're clean, is going to come out into the house. Use of the filters, the pleated media, is going to take care of a lot of it. It'll keep it from getting in the ducts in the first place. So it's not hurting anything, and especially if you bought a new house and the people before you had pets and you're allergic, it's worth cleaning the ducts. If it's just, the house you've been in for 20 years, it's not worth cleaning the ducts for cleaning the ducts.
Okay.
Yeah.
I see about 200 did not participate. What
Yeah.
were their reasons for not participating, and did you do any follow-up to try to get them back?
Oh, yeah, we hound them for a long time because these kids are sick. We know they're sick. And a lot of it is, sometimes it's a communication issue that people have minutes on their phone. And if their minutes run out, we can't talk to them. So that's an issue that people just don't have the time. If you've got 2 jobs and you're trying with the kids, that the time just isn't there. There's lots of social reasons. It's not a, I don't care about my kid issue. It's, I don't have time to work with you issue. That's a big problem. We also do complete social determinants of health questionnaires and personal safety issue questionnaires when we're at the home each time. And we partnered with ASCA, or whatever it's called now. We partnered with them so we can refer, if they have social needs, we can make those referrals. And if it's a personal safety, like we had one, out of all those kids, we've had one personal safety issue where it was a domestic violence survivor. They moved into an apartment, which was like in the middle floors, and somebody upstairs recognized them and notified the abuser. So they were having personal safety problems. He was stressing out. And so we were able to, give some assistance that way as well. We're trying to provide, do a little bit of public health, social service, a little bit of everything.
Any other questions?
What about putting filters on top of the radiator, the heaters?
On the vents?
After you've had it cleaned, with a filter on top, does that help with the air quality?
It would help, it would block some, but the filters themselves aren't geared that way because you'd be creating a pressure differential. It would be like sticking your hand over a water hose. As the water's coming through, most of it's not gonna make it in. And if you're paying to heat that air, you're not gonna get the heated air coming through, and it'll probably just blow a hole in it eventually. But having the filter before the air is heated in the furnace system down in the basement, having that pleated medium furnace filter in there will help pull the dust out before it gets into the ducts.
Thank you.
All right, thanks.
All right. Nobody present. All right, the meeting is called to order at 5:21 PM. To establish a quorum, may I have a roll call, please?
Nathan?
Here.
Dr. Cook?
Here.
Dr. D. Pompey?
Here.
Ms. Gentleberg?
Here.
Ms. Hayes?
Here.
Mr. Karat?
Here.
Ms. Coleman?
Here.
Mr. Lowry?
Here.
Mr. McGuire? Dr. Mamonis? Mr. Senderak?
Here.
Mr. Snell? Mr. Somerville?
Here.
Dr. Varian?
Here.
Ms. Williams?
Here.
Thank you.
Great, thank you. We do have a quorum. May I have a motion to conduct business by voice vote unless a roll call vote is specifically required by our bylaws, state law, or is requested by a member of the board? Thank you. Can I have a roll call vote, please?
Nathan?
Yes.
Dr. Cook?
Yes.
Dr. D. Pompey?
Yes.
Ms. Gentleberg?
Yes.
Ms. Hayes?
Yes.
Mr. Karat?
Yes.
Ms. Coleman?
Yes.
Mr. Lowry?
Yes.
Mr. McGuire?
Yes.
Dr. Mamonis?
Yes.
Mr. Senderak?
Yes.
Mr. Snell?
Yes.
Mr. Somerville?
Yes.
Dr. Varian? And Ms. Williams?
Yes.
Thank you.
Great, thank you. Can I have a motion to approve the Board of Health meeting minutes from April 9th, 2026? Thank you. Any discussion? All those in favor? Any opposed? Any abstentions?
Abstain.
Motion is approved. Are there any public or staff comments? Okay. We do have a Schedule E late filing this time, so I'm going to read those. It's on personnel. Approve the appointment of Annalise Lyman, student temporary help, part-time, not to exceed 28 hours per week at $15.50, effective May 18th, 2026. Annalise is currently pursuing a Bachelor of Environmental Science from the University of Mount Union. Annalise will work as a mosquito control technician, performing technical functions in the program. Also, to approve the rescission of the appointment of Chloe Partlow, student temporary help, part-time at $15.50. Chloe did not complete the pre-employment process. So I need a motion and a second to accept these Schedule E late filings, please.
Motion. Second.
Thank you. Any discussion? All those in favor?
Aye.
Any opposed? Any abstentions? Okay, motion passes. All right. Let's do the consent agenda. So I need a motion and a second to adopt resolution number 016-26 entitled Approval of the Consent Agenda, Schedules and All Matters on the Consent Agenda. Is there any discussion? I would like to ask Corey to provide an overview on the roof project, only because this project is $1.7 million. So if you could just do a brief overview for the board.
Yeah, sure, thank you.
Thanks.
We had budgeted the roof project about $2.3 million based on in 2022. We had some preliminary estimates and quotes done that a 30-year roof was going to run us about $1.9 million. So in 2022 with inflation, we were kind of guesstimating that for budgeting. We had started working with the County of Summit, who we collaborate very closely with all our capital improvement projects, because we don't do a ton of big projects. They do a lot of big infrastructure for the county, and had directed us towards a cooperative purchase agreement with the vendor that you have on here. They came in at around $1.4 million, so significantly under our 2022 estimate by over $500,000. And that's with a 30-year guaranteed roof. So it should hopefully be here long after all of us retire. They've had good success with this vendor. Our facility supervisor has done a reference check, and has favorable references. They'll include, prevailing wage, as it's a large capital improvement project, along with, their insurance and a bid, bond as well for the guarantee. So, is there any questions on that? Oh, sorry, one more thing too. You'll notice the price difference of, I mentioned about 1.4 million. There is an allowance built in there. We've added 25% for the approval, and that is for any unforeseen, things that come up when they pull the roof. So they've already gave us a price of, a couple dollars per square foot, essentially for, I think it's $8 a square foot for, any flooring needs to be replaced underneath the roof. So we expect, to find some unforeseen consequences, so we've budgeted 25% to start with. If the amount exceeds that, or we come into any other unforeseen consequences with the roof, we'll bring that back to board for further discussion.
And not more, just a comment. We never replaced the roof when we bought this building. So that roof we inherited. We renovated this whole building, but not the roof. So it, I would be 11 years? Yeah. So it's kind of amazing we made it 11 years. So we don't actually know what's there. We didn't do it.
It had a 20-year Goodyear warranty. It's a Goodyear roof up there now. And we had, I believe, 3 or 4 years left on the warranty when we bought the building. So we've kind of wrote it out, and you might see some water spots as you walk through the building, and it's increasingly leaking more and more and more. So.
Are they going to put a picture on the roof this time instead of have it flat?
I mean, they're going to try, it's going to have the drain, but they won't, I mean, they're trying to level it out so the drainage, flows more properly.
Still a flat roof.
Yes, yes.
Any further discussion? All right. All those in favor?
Aye.
Any opposed? Any abstentions? Motion passed. Thank you. All right. Committee reports. Community Health and Wellness, Dr. Berry.
Yeah, so, we met last time, and I had some notes up here, and then I'd say, I'm not gonna go through everything, but I'd say the main thing is we talked about how there's a bill in the Ohio State Representatives, the Ohio State House, looking to get rid of some regulations around sewer treatment systems. So I wonder if that'll impact how many of these of the variances we have to look at. We'll have to see. The rest of the stuff I didn't think was all that critical to bring up here. There's a place to bring in your used bike helmets that get recycled here. Those are the main things.
We did vote on a chair and co-chair, right?
Yeah, Vice Chair and Dr. Blakeslee, who's not here, is the chair.
Thank you. Any questions? Anyone? All right. Financial operations, there's no report, but we do have a meeting following this meeting. Governance Committee, no report. Human Resources, no report. And Strategic Planning, no report. We are going to look to, once we have those first meetings, we will look to appoint a chair and a vice chair. All right. Health Commissioners report.
All right, good evening. Finance Operations Committee is scheduled to meet here in the boardroom following the conclusion of the board meeting. Governance and Human Resource Committee is scheduled to meet following our June 11th Board of Health meeting. Human Resources will be in the DOC and Governance here in the boardroom. With regards to program and fiscal updates, I included this in the Health Commissioners report, but it's a summary of the President's budget request. This is the beginning process for the federal budget allocation conversations, but I wanted to touch on a few points. This is very similar to what was proposed in 2026. For Health and Human Service, they are looking at restructuring hepatitis, STI, and tuberculosis funding into a new block grant. The FEP Cooperative Agreement, they're looking at a 52% cut to FEP. That, again, was proposed in last year's budget. The HIV prevention funding, the state opioid response funding, and Title X family planning are intended to be eliminated. And chronic disease programming, we're monitoring this. They're looking at developing an administration for a healthy America. I'm still unclear as to what chronic programs will fall underneath AHA. So more discussion to come on this. But again, this is the beginning of the process. Last year, Congress level funded most of these programs. We had some reductions in a few programs, but it was level funding within HHS, mostly for the grants that we receive. EPA, they intend to do a 52% across the entire EPA organization. The significant concern that we have is in regards to local air monitoring districts with a 91% in categorical cuts. Again, that was level funded last year. This is a very similar proposal in the fiscal, their 26 proposal. There's a $200 million decrease for WIC that is intended, but ultimately we believe it's going to be relatively level funding for our WIC program. There is some concern with rising food costs in regards to the WIC allocation, but we're monitoring conversations as that progress. For HUD, they're looking at a 13% reduction in overall HUD funding. There's a significant impact to community developmental block grants. We do not receive those grants specifically, but we do receive the Lead Hazard Reduction Program grant. They're looking at a 63% decrease. But again, the same proposal was made in fiscal year 26, and we were level funded for that program. So I just wanted to let you know that this is the beginning of the conversation, the process of the proposals. It's very similar to what was proposed in 26, and we'll be monitoring discussions as they occur. A few other updates. Environmental health transition to the health-based cloud software solution. There was a summary of that provided in the Health Commissioner's report. The new system will allow payments to be made online. The public can view inspection reports and also enter complaints. Tanya, I don't know if you have any other updates on that. Okay. Behavioral health achieved CARF accreditation. So congratulations to behavioral health. Corey, I don't know if you have an update on that or wanted to.
Yeah, sure. So we got our CARF national accreditation for behavioral health. This is now a requirement to offer any sort of community behavioral health services to have a national accreditation. We received no recommendations, which is the top 3% in the nation, which was nice to hear. And so we'll then have to get after our inaugural year, we'll go for our 3-year accreditation after that. And we were able to obtain our behavioral health services from DHS for outpatient, case management, and care services. So more to announce on that, but we'll be offering some programming for low barrier MAT services.
Thank you.
Is that what our pins are for?
The pins are for accreditation.
Okay, not that accreditation though.
No.
Behavioral health and public health.
We went to a spring conference for the public health associations in Ohio, and ODH passed these pins out for most of the health departments of the state of achieving accreditation. A few other updates. There is an article in the Akron Beacon Journal, actually a series of articles that was highlighted in the Health Commissioner's report. Did an excellent overview of our food inspection programs and services. If you haven't had a chance to look at those articles, I strongly recommend it. It's phenomenal coverage for the agency. And then also the agency conducted a meeting for the Community Health Improvement Plan that was kicking off. This was a collection of stakeholders that came together to work through some of the challenges that we had identified. We just completed that on Monday. ODH also released an Ohio School Immunization Database. This identifies kindergarten immunization data, specifically for MMR, DTaP, polio, Hep B, and varicella, and you can search it by county and also by school. So it's a very good resource that ODH recently published and made available, and that link is also included in the Health Commissioner's report. That concludes my brief, unless there's any questions.
Thank you.
Mary?
All right. Fiscal report.
Thank you. First in my report, this month we have a invoice that we need a then and now certificate approved for payment. I would need a motion and a second to adopt resolution 017-26 entitled Resolution Authorizing Then and Now Certificate. This is a invoice, obviously you see, for $3,655 to pay Brewer and Garrett. It was one that was not sent over before the year ended last year.
Motion?
Second.
All those in favor?
Aye.
Any opposed? Any abstentions?
Thank you. Second, the Budget Commission, we had our budget presentation on April 16th. Our budget was unanimously approved by the commission. And at the end of this month, the notification letters with the budget will go out to the political subdivisions. And then additionally, the monthly reports are in the packets. If anyone has any questions, I'd be happy to.
Thank you. Does anybody have any questions? Environmental health, I don't believe there's any report. All right, thank you. Clinical health, medical director's report. Dr. Lavelle.
Any questions for those? The two main points, measles were up to 1,842 cases, so a little over 3/4 of the cases we saw within the United States. New outbreak in Virginia just declared today with 12 cases, so that's starting to sprout. South Carolina did end their outbreak, and Utah and Texas have all. Also, we received a HAN alert about the hantavirus, but currently ODH does not have any either to passengers on the cruise ship or on any of it. The questions right now. Yes.
Wondering, we have just an occasional tuberculosis, and there's one that came in, and we had, 13 follow-up contacts. Is there any commonality of the sources of where these are coming from, or just kind of from everywhere? Is it a certain country that people are coming from?
It's not a specific country. I would say the majority, maybe from age or coming. So contacts typically would be 4, 5, 12, 100. Anything else?
Thank you. All right. We will need to go into exec session tonight, so I do need a motion and a second to adjourn into executive session to consider the purchase of property, both real and personal, tangible or intangible, or to consider the sale of property, either real or personal, by competitive bid if disclosure of the information would give a competitive advantage to the other side by Division G2 of Section 121.22 of the revised code. Second?
Second.
I do need a roll call vote.
Chief Chafin?
Yes.
Dr. Cook?
Yes.
Dr. D. Pompey?
Yes.
Ms. Jindal?
Yes.
Ms. Hayes?
Yes.
Mr. Carr?
Yes.
Ms. Coleman?
Yes.
Mr. Lowry?
Yes.
Mr. McGuire?
Yes. Yes.
Dr. Mamonis? Mr. Senderak?
Yes.
Mr. Snow?
Yes.
Mr. Somerville?
Yes.
Dr. Varian?
Yes.
And Ms. Williams?
Okay. This time we will go into executive session. Thank you. Angela, we're going to ask you to stay.
Angela, Corey, Dawn, you can stay. Other directors are welcome to stay if they would like. IT, of course.
With that green button right there.
All right. Let the record show that there was no action that will be taken out of exec session. And we will adjourn the meeting at 5:47. Thank you, everyone.